I lost my son.
I lost my husband.
पति मर गया, बर्दाश्त न कर पाई।
Every 40 seconds, someone in the world kills himself. In India, one person every 4 minutes dies because of it. It is one of the leading causes of premature death in the world, claiming the life of approximately 1 million individuals every year.
Every suicide affects at least 4 other members, and their risk of suicide attempt increases in return. In our country, more than 130,000 people have killed themselves in 2011. 1 in 60 people in India are affected by suicide.
Families do not talk about suicide. It is seen as shame and sin. They hide it. More than 80% of patients feel that the best way to reduce stigma is to provide treatment.
Our project is education and training for suicide prevention. Patients remain untreated and suffer detrimental consequences of suicidal behavior as well as of underlying mental illnesses. Lack of training leads to lack of appropriate services and poor awareness. Therefore, training and education, especially for people like teachers and health workers who are in direct contact with vulnerable groups, can help increase identification of individuals with related problems. They can then offer support and make a referral. Purpose of this project is to develop manpower that can aid suicide prevention in different regions globally. As the treatment of suicide behavior becomes more visible, more services are likely to be established. In this project, we propose to provide web-based resources for education applicable to individuals and organizations both. Identification of individuals who are likely to attempt suicide is extremely difficult and appears almost impossible. A detailed description of methods and measures to identify suicide and depression are covered here. These include asking key questions about suicide directly, use of screening tools, and carrying out a detailed interview. When to ask these questions?
Cultures. The questions which can also detect depression are
Reading and practicing the techniques described here is likely to facilitate identification of suicidal patients amongst those who are attending primary care clinics.
It's possible for doctors to recognize the warning signs, but all need training. We need to train them.